Hello everyone! So we are the group 3 and today we are going to discuss about common signs of drug use. Signs of drug use and addiction. So in this topic, we will be able to know what a person will feel and experience using drugs. How can we tell or identify if someone is on drugs? Drug addiction often starts with experimental substance use in social settings. While virtually any substance can be abused, some drugs carry a higher risk of dependency and addiction than others. It's important to identify instances of substance abuse early on so intervention can occur before addiction takes hold. There are common signs of habitual drug use across all substances, as well as signs that are unique to the type of substance abuse. Knowing these signs can help to identify whether a loved one may be using drugs and risking harmful consequences to their health, school, job, and family life. So here are some signs and symptoms of drug use and addiction. If a person is using or abusing any drug, there are some of the general signs to look for. These include difficulties at school, disinterest in school-related activities, and declining grades. Drugs can mainly affect our studies. It may become a reason why someone cannot able to focus on what they are studying that result to have failing grades. Poor work performance, being chronically late to work, appearing tired and disinterested in work duties, and receiving poor performance reviews. If someone is using drugs, they feel always tired and they don't have the interest to do work. Changes in physical appearance such as wearing inappropriate or dirty clothing and a lack of interest in grooming. Someone is using drugs if they don't have time to groom themselves. Altered behavior such as an increased desire for privacy. It is also a sign that someone is on drugs if they always ask for privacy. Drastic changes in relationships, a noticeable lack of energy when performing daily activities. Spending more money than usual or requesting to borrow money. Issues with financial management such as not paying bills on time. Changes in appetite such as a decreased appetite and associated weight loss. A person using drug loses appetite that results to body weight loss. Signs of sadness, depression, agitation or hostility, bloodshot eyes, poor skin tone, and appearing tired or run down. Defensiveness when asked about substance use, evidence of drug paraphernalia, or kissing prescription drugs. There are also some signs that someone may be under the influence of a drug, which include enlarged pupils, bloodshot or glassy eyes, increased energy and confidence, loss of inhibitions, loss of coordination, aggressive behavior, trembling, twitches, paranoia, or being extremely suspicious, hallucinations, or hearing or seeing things that aren't really there, nausea and vomiting, complaints of stomach cramps, blurred vision, headaches or dizziness, exhaustion, fatigue or insomnia, or being unable to sleep. Irritability and moodiness, changes to eating patterns such as eating less or more. Anxiety symptoms such as panic attacks, dizziness, sweating, dry mouth, muscle aches, and headaches. Always remember that drugs can affect different people in different ways, depending on the type of drug taken and whether it is a depressant, example alcohol, or stimulant like methamphetamine. Use may become addiction when users continue to seek and use drugs or alcohol despite the negative impacts of using the substance.
How to spot drug use in adolescents. Sometimes we cannot determine if the adolescents are users of drugs since when we grow older, especially when we become teen, there are changes in their habit and attitude. Oftentimes we think that adolescence is normal to act that way just because of growth. Here are the common signs on how to spot if the adolescents are users of drugs. First is mood swings. While common in teens, addicts are prone to mood swings when being under the influence. Drugs affect a part of the brain known as the limbic system. This is the area responsible for processing our emotions. Drug-related changes to this area can contribute to mood swing, emotional outbursts, and persistent irritability. Next is depression. Many individuals can fall into a deep depression by their situation. Depression is common among people that are using drugs or alcohol. Substance abuse can trigger or intensify the feelings of loneliness, sadness, and hopelessness often associated with depression. The symptoms of depression can drive some people toward substance use to cope with their condition. However, consuming drugs or alcohol to self-medicate depression symptoms can increase the risk for addiction. Next is change in appearance. Some drugs can have a depleting effect on the user's body. It can cause acne breakouts on your face and body, baldness in men and facial hair and baldness in women. It can cause development of breasts in males. It can also make your mouth dry, teeth clenching, and poor dental hygiene, resulting in wet mouth. This one is the easiest way to spot if the adolescents are using drugs. Drug can lead to red eyes. The drugs or alcohol may dilate the vessel in the eyes, which make the eyes dry and red. The next and the last one common signs to spot if the adolescents are using drugs. As what we have noticed, if the person is using drugs, addicts tend to hang around with people with similar addictions and close friends who tolerate their behavior. Parents should observe their children and be a good role model to everyone to prevent drug abuse. And as adolescents, we should find a circle that guide us and help us stay focused on positive goals that doesn't include drugs.
Hi, I am Vea Buenvenida, your class reporter for this day, and I'm going to share to you the sign of abuse related to specific drugs. In addition to general signs of drug use, specific signs of abuse are associated with particular drugs. This information can help a person spot signs of abuse in a friend, family member, or co-worker. But what are those specific drugs? Do you have any idea? Let's check it out if you get the right answer. First, we have here marijuana. But what does marijuana mean? So according to Merriam-Webster, marijuana is the psychoactive dried resinous flower buds and leaves of the female hemp, or what we call the cannabis plant. Marijuana and other cannabis-based products such as edibles may induce euphoria. This can cause heightened visual and auditory perception to the user, but also they seem uncoordinated and forgetful. But since cannabis increases appetite, the person may eat more than usual. Reaction may be slower, and the user may also become paranoid and suspicious. Those who have smoked marijuana, on the other hand, often appear with bloodshot eyes, droopy eyelids, and an overall relaxed or mellow demeanor. Next is stimulant. What does stimulant mean? So according to Merriam-Webster, it is an agent such as drug that produces a temporary increase of functional activity or efficiency of an organism or any of its parts. So basically, a person on a stimulant may exhibit frequent behavior changes, aggression, or rapid or rambling speech. They may display dilated pupils, increased energy, and a fast breathing rate. In some cases, users may become paranoid or hostile. If users snort the drug, nasal congestion is a common sign of use. So snorting drugs like cocaine can damage the mucous membrane inside the nose. Just a little bit trivia. Did you know that coffee can be considered a stimulant? Yes, you heard it right. Since caffeine powder effects can include increased breathing and heart rate and increased mental alertness and also physical energy. Depending on the individual, these effects can last up to 12 hours. Next is barbiturates and benzodiazepine. These CNS or the central nervous system depressants are often prescribed to treat anxiety and sleep disorders. Benzodiazepine include common medication such as Valium and Xanax. Barbiturates are not used as much as they used to be. However, they are still sometimes employed to treat seizures disorders and during surgery. Barbiturates carry a higher risk of overdose than benzodiazepine. A person who abuses these drugs may appear uninhibited, dizzy, or depressed. They may experience blurry vision, balance issues, and overall confusion. They may also present with involuntary eye movements known as nystagmus. Next is hallucinogens. The signs of hallucinogens used vary depending on the specific hallucinogens in question. LSD may cause a person to act impulsively and experience hallucination. They may claim to hear colors or see sounds, and in some cases, they may experience tremors. If a person has used PCP, they may be able to feel pain and seem intolerant to loud noise. Someone who has used psilocybin or the magic mushrooms may experience hallucinations, nausea, muscle twitching, and difficulty in differentiating between hallucination and reality. People on hallucinogens may appear drowsy, panicked, or at peace, depending on the type of the trip they are having. Last is club drugs or the party drugs. Ecstasy, ketamine, and GHB are common types of club drugs. Signs and symptoms of use include increased body temperature, poor coordination, dizziness, excessive sweating, clenched teeth, and slurred speech.
I am CGT Benito and I am the last reporter of this group, and today I will read only the importance of early interventions of treatment. If drug use is suspected, early intervention is essential to ensure the most robust chances of successful recovery. Friends and family members may choose to stage an intervention once signs of drug use are apparent. If so, a professional interventionist can guide the planning process and execution of the event for best results. Loved ones should also research comprehensive addictions treatment programs. Treatment should include both medical detox and therapy to address the underlying issues related to the substance abuse. That's all.
So that's the end of our report. Thank you everyone for listening. God bless you all and have a great day. Wow.